We spent some time talking to about 400 healthcare professionals out there, and what we found was about 25% were skeptic that there was any opportunity kind of in a revenue cycle capacity. And another 25% said, you know what, I'm just not sure about how I would apply it. So not that they're for it, they're against it, I just can't imagine what a use case would be. And I think that really points back to the need of how do you start to break down some of that fear of the unknown? How do you start with the education and make AI something that people think about of, I want to experiment, I want to try. And at Inovalon, I take this into our business and rev cycle, and you can take a process like eligibility. But when you start to think about, well, how could we make that process better? How could we make it so that you don't need to have manual inputs and entry, or the data isn't always perfect. You are setting, you're not always going to have every piece of information. How do you use technology to innovate and really make sure that you can bring in that streamlined process without having to introduce that friction to the process? So.
Being a pharmacy background, outpatient retail pharmacy, specialty pharmacy is kind of big, right? There's a little bit of money that's involved in specialty these days, and even back then. And we had implemented Snowflake, and we implemented Looker on top of it. And I knew how important it was when you look at a claim. If you do a claim incorrectly in specialty, it can have a very significant financial impact. And so I had a thought, I had a hypothesis. What if I did anomaly detection, right, on specialty pharmacy claims, and what would that garner? I didn't have a specific thing I was looking for, but this is where you start to get into ML and AI. And so I was like, it was ML back then. It took me a week to figure out how to create anomaly detection. And I'm technical enough to be dangerous. My guys know that. Our organizations loved it, and they were like, "Hey, can we get this?" And so we gave it to them, and the numbers, revenue cycle, it was significant. It wasn't $10, it was like $10,000 per claim in a lot of cases where something was done incorrectly. So fast forward, and now inside cloud platforms like Snowflake, and I literally created the same thing. It took me 5 minutes. So I think that's the point to get across, is that whether you want to utilize a large language model, or you want to do anomaly detection, or you want to do forecasting, okay? Those three things I just said, in your head right now you're thinking, data scientist, data scientist, data scientist. We don't have large language models and transformer models and base models and all that without the data scientists. But there's not enough of them to be engaging with them on a daily basis, but we now have an ability to say, I've got the technology at my fingertips to go in and say, my favorite examples, I want to run sentiment analysis on a big chunk of unstructured data. That used to be a big deal. Like, that was a 3-month project. You grab the data scientists, go start training and all of that. Today, it's one line of code inside platforms like Snowflake. So don't be intimidated. I think that's what we were kind of talking about, like we want people to walk out of here with, is that AI and ML should not be intimidating to anybody in this room. It doesn't matter how technical you are, how non-technical you are. The tools are to a point now where you can go in and engage it and take advantage of these type of capabilities, and you don't have to be a data scientist, right? Again, they don't exist without them,
yeah.
right? But you don't have to be one to utilize it. So I think